Hi, my name is Eve, and I'm back again today on this episode of Beyond the Genetics. Today, my guest is Dr. Amarachi. She's a medical doctor, a writer, a public speaker, and then this is the most important part. She's also a very good friend of mine. Amarachi, welcome to Beyond the Genetics. I'm so excited that you are here. I'm very happy that you agreed to do this.
Oh, I'm so excited to be here as well. Hi, Vie. Thanks for having me on. How are you?
I'm doing fine. I'm doing good. It's a good day. And it's a podcast day. Yeah. I'm just going to give like a background of our relationship and how we got to this point. So, Amarchi and I met 2000 and it's in 19 or 18 now. I don't really know. What year was it?
2019. 19.
So we met at a plastic surgery hospital where I was working permanently at the time. And she came in as a locum to cover for a colleague who had gone on leave. And yes, that's how our relationship started. I don't really think that we started off as friends. I think it was more of like a cordial working relationship
Yeah.
at the time. And then
Yeah.
as time went on, we now became friends, which brought us to this point, and I'm just thankful for that whole experience.
Oh, blossomed into friendship.
How would you say like our relationship was like when we're working? How's the working relationship? How would you just like describe that moment?
I would say initially it was really professional. And even when it was just like really professional, we had this mutual respect for each other. I
Yeah.
think working with you as well as the other doctors at
Mm-hmm.
the plastic surgery hospital was just, well, I use the word wholesome because it was just so easy. If you need someone to cover your shift, the person is always there to cover your shift. If you need someone to, even though it was professional initially, then it was really easy for us to become friends because I think we had the same kind of ideas and thoughts
Yeah.
and the same work ethics. Everybody was coming early, sorry. And why did I say late? Oh my
I
God.
don't know.
Everyone was coming early. Nobody complained about anything, basically. I mean, it was refreshing. I liked it.
Yeah. I definitely can relate to that, and I feel like I have the same experience of what you just described as well. I'm making it a habit to sort of like ask the doctors that come on my show because I'm really interested in knowing people's answer. Maybe because I haven't kind of figured my answer yet, but why did you choose
Mhm.
medicine? Why did you choose to become a doctor? Like, why? What's your reason behind all of that?
The truth is, I've always wanted to make an impact. I've always felt that that's my mission on earth, like to make an impact. But I didn't know how to go about it. I didn't know in what field I'll make the impact. Then I think when I got to high school, I started tending towards the sciences. And then I
Mm.
think I did a little bit of research and I decided, okay, medicine. I don't think there's any personal story per se, but it was just more of finding my path. I think I just always felt that I needed to do more, do something. And then I
Yeah.
realized at some point that health medicine is what I wanted to do, where I wanted to make an impact.
Like you said, making an impact, regardless of how stressful medicine can be, you actually do make
Mm-hmm.
an impact while you're working and your interaction with people, the people that you meet. Sometimes you just really touch people's lives, even by the
Yeah.
littlest thing that you do that day can just make someone's life different and better. So it's a good path to take if you are thinking about making a change. But it just comes with its own plenty wahala, shabo. We are surviving.
Yeah.
So now you are into fertility and you've been in this like specialty as a fertility physician for a while now, I believe. I
Mm.
just want to know like why did you decide to like venture into fertility? From what we've discussions and just how I've seen you from afar and up close and all of that, I know that you are very interested in this. It's something that you are quite passionate about. So why did you choose fertility? And then is being a fertility physician, is it a pathway to something else? Or you feel like this is it, like you found your bearing?
Well, I chose fertility because there's not enough awareness on fertility, and I do a lot of creating awareness
Mm-hmm.
online on health related issues, women related issues as well.
Mm-hmm.
So I realized that fertility is not the right information. We don't have a lot of them out there. Because I mean, I think I was on Facebook one day and then I saw some of these trying to conceive groups, and then I saw a lot of false informations, a lot of wrong informations. And I'm like, nobody, and because fertility is something that in our society, the women get really desperate. So they listen to every information
Yeah,
that passes by them. So I'm like, I need to put the right information out there so they don't end up harming themselves. Yeah. So I
yeah.
decided to go into fertility medicine. In fact, from the beginning, I loved everything about fertility medicine, and I didn't even waste time to start creating the awareness out there. So you asked,
If this is a
there was
pathway
this,
to something else,
if
or
this is
is
a pathway to something else. Yeah. Okay. So yes, it is, because like in Nigeria, you can do the subspecialty, which is fertility medicine,
yeah.
before you start your OBGYN, that's the obstetrics and gynecology. So
Mm-hmm.
yes, it's a pathway to that, because that's what I like want to do. I mean, to actually do the whole obstetrics and gynecology. Everything is connected, is interrelated. So
Mm-hmm.
yeah.
Yeah, that
Fertility
sounds
medicine is actually a subspecialty of obstetrics and
Obs and
gynecology.
gynae. Okay,
Yeah.
that sounds really nice. I've never really been like an Obs and gynae fan, honestly.
Oh
It's
wow.
just one of the specialty that I don't like, but I don't hate as well, but I just can't do it. It's just it's just in that box right there with ophthalmology. Ophthalmology is even in a separate box that I can't even think about it. But ups and gynae, if it sort of happen and I sort of like just see myself doing it, okay. But ophthalmology, no way. Like it can't, not even mistakenly,
For real?
I can't do it. I can't do it. The whole betting process and the whole like I think it's the obstetric part of it that really
Oh,
just I don't want to
mm,
do. I think more of the gynae. I don't so mind the gynae part of it, but the obstetric where it takes a lot to just be in that whole specialty. Props to
yeah, it
all
does
the
really.
gynae, all the fertility
It
physicians
does
and
really.
I think that one of the things that we connected on, which you sort of like kind of mentioned in when you were describing your love for fertility, was your love for giving back, which is one of the things that I feel and not I feel I know that we have in common is our community service, our love for community work, our love for voluntary and just sort of like making an impact in the community in the work that we do. I can remember that we did an outreach together where we spoke on cervical cancer. Do you remember?
Yes, I
Yeah.
do, of course. I still have those pictures.
I know, and the videos I spoke to those
And
high school children on cervical cancer, and that was
yeah,
a good moment in our friendship as well, and took us further down that path
true,
of actually being friends. Because
true.
we found out that we had that same interest in just being a part of things like that. So now you're now doing that with your fertility, and you have a YouTube channel, a platform. So can you just tell us about your YouTube channel, your platform, the things that you're doing, and just the whole package.
Okay. So my YouTube channel focuses on everything and anything women's health and infertility. So I try to upload at least one or two videos, at least one
Mhm.
video per week. And I feel like if you have like any fertility question in your head, I have probably already done a video on that. So the channel name is Dr. Amarachi Ijeoma. And I think I started the channel 1st of January this year
Yeah.
because in the past, what I was doing was just posting articles on LinkedIn really regularly for 3 years and then a little bit on Instagram. But then I decided, okay, let me take it up a notch and go post on YouTube so I can reach more audience. So yeah, it's all about creating awareness, quelling misconceptions on infertility, women's health. So that's basically what it's about.
I won't say it publicly, and I hope that I have said it privately as well. It's just how proud I am of you. Of I remember when you were talking about doing this, and you were like, "Oh, I want to start a YouTube channel." And when your first video dropped, I watched it, and I was like, "This is great, and it's going to be something amazing." So I just want to say that I'm really,
Yeah.
really proud of you for what you've done
Thank
and journey you're
you.
on and how far you've come. And I just know that you're going to do more amazing things. And so everyone
Thank
listening,
you so
check out her channel. Check it out. Check it out. Check it out. It's quite amazing. It has a lot
much.
of information in it. So yeah.
Thank you
Uh,
so much. I'm so
you're
proud of you
welcome.
too, Dr. Ivy.
Ah, thank you. Why do you have to be doctor? You have to be a doctor.
Well,
Making it all professional.
okay.
Like doctor.
All right. I mean, I started with EVA, then I'm like, okay, it's her podcast, so
No, call
let me
me
make it
Ivy.
a
Ah, call me Ivy. Like it's just like
bit.
even outside here, when people are like Doctor Ivy, I'm like, ah, just call me Ivy. You don't have to be all just professional about it. Just call me Ivy. Ivy
Okay,
is a nice name
that's
too.
fine then. That's fine then. Well, I'm so proud of your growth as well because I know when you all of these was an idea and now it's like a reality. So I'm
Yeah.
so happy for your growth.
Thank you. I still remember when we were talking about it. I was talking about starting my foundation. You were talking about your YouTube channel.
Yeah,
Look at
that's
all.
true.
You doing your thing, I'm doing my thing, and
Right.
your giving back, your community service, your voluntary. Have you ever been involved with anything like sickle cell related, like sickle cell outreach or whatever it is? Even if it's just like in your medical career, have you been involved with a sickle cell patient? Have you managed one? So this is like a
Yeah.
two-part question, but yeah, that's it.
Okay. Yeah, in my medical career, yes, I've managed a few sickle cell anemic patients. I have.
Mm-hmm.
Mostly they come in with pain, that's the crisis, and then what we have to do is try to stabilize the patient, give them fluids and painkillers, and most times sometimes within 24 hours, they are good to go home. I have.
So, how do you say that the medical management of sickle cell patients is in Nigeria? Like the hospital that you worked in, how was the management? How in terms of painkiller and other forms of management? How would you say? Because you hear of stories where sickle cell patients go to hospitals, they don't have oxygen, they're being given suboptimal medications, and sometimes they're just being overlooked as far, or you can't be in that much pain and all those kind of things, horrible things that you hear in terms of management. So how would you say the management is in Nigeria and how would you say the management was at that hospital that you worked in?
Okay, so the hospital I worked in was a private hospital. I think it was a pediatric hospital, and we used to have like a couple of sickle cell patients come in. And sometimes when we do the normal stabilization, if they don't get better, if there's no
Mm-hmm.
improvement in the pain, most times we invite a hematologist, and then the hematologist takes over the treatment. So, and we always had oxygen. I think we did a pretty good job there. So, if you are actually finding it difficult to get a hospital or if you are currently using a hospital that you feel they are not doing like the best that you feel like they can do, then you should consider getting a second opinion in another hospital because there are hospitals in Nigeria that are really doing well.
Yeah, I agree with that. I agree. I totally agree with that. And the whole fact of bringing in a hematologist is very important because sometimes people don't do that, especially when you've
Yeah,
gotten to a point where you can no longer acutely manage them adequately. You should bring in a
exactly.
hematologist that this is what they specialize in, so they'll be able to sort of like manage better and
Yeah.
just make it better because it's just really horrible when you hear some stories and it's so bad to leave someone in that situation and just being like, oh, there's nothing else you can do. So you're going about your day. Like, it's so, so bad.
Yeah.
When I hear those stories, it honestly just breaks my heart because
True.
you just keep on
True.
thinking that this can happen to anyone. It can honestly happen to anyone. And just the fact that I consider myself fortunate in just with my whole experience with sickle cell, I consider myself fortunate, it doesn't take away the fact that this is happening out there. And that is why, like, being into Things Sickle Cell Foundation is just a way of creating awareness to make sure that the lives of warriors are better, their families' lives are better, because it affects every single person. It affects the family, it affects the friends, it affects like a
Yeah.
general, and it touches everybody. So having to spread this awareness and just make people know that it's not about pretending. Like, I'm not coming here to come, and it's not always about drug seeking behavior. My pain is real. My pain is existence. Like, these tears are real. And just pay attention to
Yeah.
give me what I need, give me the right treatment, and let me go home because I don't even want to be here. So it's nice, and I like it when I hear of hospitals, because I know a lot of private hospitals really try to work with their management, and a lot of them are doing really, really good jobs as well. So
Yes.
I know about that because I've worked in a private hospital before, and they did a really good job managing sickle cell patients. Do you
That's
have
good.
a personal experience with sickle cell disease?
Yeah, I do. A family friend. She's almost like, in fact, she's like a sister. Why did I put almost? Like a sister to me. And ah, man, there's sometimes she was in university at some point when I was already working as a doctor. She was still in university. She's a younger friend. And I would invite her, I would tell her to fly all the way back to Lagos, and we would go to a hospital just for the crisis.
Yeah.
I mean,
Wait, so she will
like you
fly
said,
to Lagos in pain?
not in pain, they'll stabilize her, then she'll fly to
Okay.
Lagos. Yeah, because at some point she felt like getting treatment in Lagos is better than over there. Like you rightly said, it's not something that only the person is experiencing. The family, the friends, every other person is on the journey with them. Yeah, that's my experience.
Yeah, I can imagine how worried or how stressed you'd be, like someone calling you from another state and just being like, I'm in pain, I'm in the
Do
hospital,
you get, so
getting
you
better.
feel like you feel helpless all the way,
Mhm.
like you're not in the same state with the person. So it's
Yes.
not, yeah.
And your mind just sort of like times everything the person is saying by 10 or by 100. The person's like, oh,
True.
you're like, oh my God, she can't breathe, she can't do this. Oh, what are they doing? What are they? Goodness, I can't even imagine being in that spot. Like, I have been in the spot of, I've actually been in both spots though, as the patient, as the relative, and as the doctor. So I've sort of like covered
Wow.
every angle that
Yeah,
I'm not like
yeah,
covered
that's
every
true.
angle. Because I remember a time, because I have a sister that had sickle cell. And I remember a time that she called me and she was just telling me her symptoms and just a lot of things that were going on. And I was just so worried because I wasn't there. Although she was in a good place and, they were taking care of her, but it still doesn't take away the worry of what
True,
is happening, what would
true.
happen, especially when it's just different when you are in medicine and everything just starts. It's like, how they be like, oh, what's the diagnosis and what's the differential diagnosis? You start making a list in your head of all the possible things that could go wrong, and you're just driving yourself crazy, like, oh my goodness, it
True.
could be this, could it be that, could it be that? And you just end up in
Mm,
like, this whole state of helplessness and just in complete pain, not actual pain, but like pain from someone you love.
yeah, yeah.
Mhm. Yeah, I just hope that things get better, not, because it shouldn't be just private hospitals, some private hospitals that are doing a good job. It should be a all
All,
thing. People should feel safe going to the hospital. Sickle cell patients should be attended to. So I hope that
mm,
things get better. And I do. that this podcast is able to educate people and bring light into a lot of things that have been in sort of like a darkness. So, in your medical
Mm.
career so far, in your whether it's pertaining to your present specialty being working in fertility or just throughout your medical career, is there any particular case or any patient that has impacted your life in a way, any case that has made a difference in your life, or any patient that you have attended to that sort of just impacted you, touched you, or changed things? Do you have that experience?
Yes, I do. When I worked loose, I had a cancer patient
Okay.
and she was going through severe pains,
Mm-hmm.
and she was really positive about it
Mm-hmm.
and she was so warm and amazing. Yeah, she passed on, but even till the last day, I was on duty and she was still positive. Like she knew she was going to pass on somehow, but she was just really saying really positive things. And I'm like, if someone in this extreme pain can be
Yeah.
this positive, you know, how much more? Like, I was really, really, really touched and inspired by her. It was one of the most touching experience I've had since I started working as a doctor.
Yeah, I can honestly, I can relate to that. And my own experience is so similar to what you've given. Mine was in a private hospital I was working, and I had this patient, a pediatric patient, and she had cancer. I think it was osteosarcoma, and like it was just she was because she's late now. May her soul rest in peace. She was
Mm,
such a light despite everything that was going on around her and what she was going through and what the next stage she had to take. She was such a light. She was smiling. She just lived like she didn't have any problem at that point. So it just makes you look at things differently. Like if someone having so much on their shoulders and yet they're able to still bring this light into the lives of the people around them, then that is definitely something that just makes you take a second look. And my experience is definitely
yeah.
similar to yours. And every day I just remember that whole moment and that whole time. And I'm like, this is a way to, it's just a way to just not always carry your problem. Is it on your face now, on your shoulder, or where is it?
I think his shoulder.
I'm like on your face, and everybody knows that you have problems. I just continue to be a light, really. Like just continue as much as possible. Continue to be
Yeah.
a light despite what your personal life may look like, because you don't know who you are going to touch, whose life you're going to impact, and the person you're going to make feel better. So this is like a general question. What would you say your scariest moment or one of your scariest moments in life has been so far?
Well, this is one question that feels like I'm on the spot. But if I have to think like I'm on the spot, which I obviously am, I would say my final year results in medical school.
Yeah.
And this is because I schooled in the East where they speak mostly Igbo.
Okay.
And I don't really understand the language. So the exam had a lot of Igbo patients. You know how you have real patients,
Yeah.
yeah, during the exams, and I couldn't speak the language, and I just kept communicating in English to old women and old men that could speak only Igbo, and I honestly thought that would affect my results
Yeah.
because yeah, but when it was time to like collect my result, I was that was the scariest moment of my life. But I passed, so we thank God.
Oh my goodness. You know this story you just said during my MDC, like the whole Nigerian medical exam, because I didn't school in Nigeria, I had to come and do a course and then take the exam. So during the
Yeah.
exam, one of my patients was a lady. I don't know if she was acting, I don't know if it was real, but I just felt like this has to be real. Like, I don't know. I don't think the lady could speak English. And it's Lagos. I can't speak Yoruba. Do you understand? And I'm just there, like, what am I going to do? See, I just started speaking pidgin. And I just we talk to pidgin. I was like, waiting bring you, like, what is it? And I was just like demonstrating and touching and like, is he here? Not here? All those things. I was like, goodness, I have definitely failed this station. And if it's just 4 stations, and I failed one,
My God. My God.
what will be the sense of my results?
My
Oh
God.
goodness. And after that, I think she was either the first or second person I had to attend to. So I had to take that anxiety from that patient into the next, but I just had to get myself together and, carry on.
Yeah, that's the truth
Oh
too.
my goodness.
You just have to forget the anxiety from the previous session.
And
So
just move on, no, like just move on. But one of my scariest moments of I would say, like, if I'm to pick, I think I've had quite a number of scariest moments, but if I'm to pick one, it would be like during my house job, my medical internship. I did mine in St. Nicholas Hospital, and I was on call. So, on call, we worked from, is it 8 a.m. to 4 p.m. the next day or something like that. And
yeah.
so I was on call with this. We had two house officers, me and someone else, and then two, a bit more senior doctors. And everything was going well. I was attending to my patients, I was doing my thing, and I was preparing my handover, because we had morning meeting every morning to discuss the patients that are on the ward, how they're doing, and then the new patients and consultant just bombard you with questions, and sometimes you're just looking like, who sent me to do this medicine work? And then you're
Yeah.
just like, so that's what I was doing. I was trying to do my handover, and then the next thing, I just noticed that I could not breathe any longer.
Wow.
It felt as though someone had, how you put a cover on a bottle. So I felt like
Yeah.
my trachea had a cover on it, and I honestly could not breathe. Like, it was just a sudden experience. I couldn't breathe. I was honestly, I've had so
Oh my
many
God.
sickle cell crises, but that is one of them that has scared me because, obviously they rushed me to the emergency ward in the hospital, and then my sats were okay. Vitals, I
Yeah.
believe my vital sounds were okay, but I couldn't remember what the other ones. But I know my oxygen saturation was okay. But it still put me on oxygen. But I still couldn't breathe because I wasn't taking enough air in. Like, I felt like someone was choking,
Yeah.
covered my trachea. And I just remember lying down there, and there were three people that came to my mind at that time. It was, my mom and my sisters. It was one of my friends then in house job, my very good friend, I consider her a sister, and someone else. There were just those three people that came to my mind, and I was like, oh my goodness, like, what's going to happen? Because you know how my oxygen saturation was low. I don't know, maybe it would have felt better that, okay, maybe I'm not getting enough oxygen. But my oxygen saturation was fine. So I'm like, why can I not breathe? Because obviously, like, I'm not breathing. I'm really, really not breathing. There's no air
That
going
was
into, there's no, so I was really scared of that fact that, okay, oxygen is looking fine, but I
yeah.
know that I am not breathing. Like,
That
I
must
know
have been
that
so scary.
I was so scared. I was frightened. My sisters were not around, and my mom, because I did my house job in Lagos, I grew up in Warri. My mom was in Delta State. Had no idea what was happening because this happened either very late in the night or very early hours of the morning, like maybe 1 o'clock. And I just did not know. I'm like, is this going to be it? Like, that was one of my crisis experience that I felt like, is this going to be it? Like, I was just really scared. And I remember after a while, things just sort of like normalized and I was able to have some sleep and my breathing was feeling a bit better.
Thank God.
I'm used to a lot of sickle cell crisis experience. Like if it's my chest and if I was having chest pain, I honestly wasn't even having chest pain. I wasn't like, oh, I'm having like acute chest syndrome or I wasn't having chest pain. It was just that this air is not entering and I don't know why it's not entering and I don't know why I cannot breathe properly. And I just remember everything normalizing and I woke up in the morning. Actually, my friend had come to see me and I don't know if she touched me or, but I just opened my eyes and I saw her and I felt really relieved and I felt really happy. Like, okay, I've
Wow.
gone through this stage and I'm out of the woods. And yeah, that was one of
Wow.
my scariest experience. And in that whole process, I was just thinking about my family and if anything happens. Oh my goodness, I started
My
crying.
God. Oh my God, I'm
Why
so
do I cry?
sorry.
I started crying again.
I'm so sorry. This is so scary.
Yeah, I know, because even in that whole moment, it was just my family I was thinking about. I'm like, if anything happens to me, I don't know how, they'll be able to just move on from that whole thing. Like, how they'll be able to get over it. And, oh, goodness.
I'm
Okay,
so
let's move on
sorry.
to, let's
Yeah,
move on to the
Evia,
next
you need to take a deep breath at this
question.
point. I'm
My
so
voice is
sorry.
breaking. I'm crying. And
Yes, and drink water. My God.
I'm not going to be crying on every podcast episode because I need to just
No. No, but I feel like it's okay if you want to cry.
knowing that we're going to have this, because in the foundation, sometimes we have talks and presentations and just like online conferences and things like that. And one of the questions that always just come up is about sickle cell, fertility, pregnancy, cell in a cell warrior and things like that. So what I
Yeah.
did was that I have asked members of my foundation, as well as just opening it to the general public to send in sickle cell related questions and just general fertility questions because why not? We are here, we answer them.
Yeah.
But some of them may that I because I read through some of them and I saw that some of them sort of overlap with obstetric and gynae, which we talked about earlier that fertility is a subspecialty under obstetric and gynae. So we try and answer as many as possible, or she would try and answer as many as possible because I don't think I can answer
Yeah.
somebody. Yeah, so I'm going to start with the first one. So the first one says, how do sickle cell patients deal with crisis in pregnancy as opioids are usually contraindicated in pregnancy?
Are opioids really contraindicated in pregnancy? Because as far as I know, none of the analgesics have been found to increase risk of major malformations.
Hmm.
Although caution should be used when prescribing them in late pregnancy. So there are like two categories of analgesics you can use. You can use opioids actually, and you can also use non-steroidal anti-inflammatory drugs. You can even also use your normal Tylenol, paracetamol sort of medications. But it's just when you're getting to the late pregnancy, third trimester, you want to be really careful with the dosage you use in third trimester of some opioids. So it's like when you use codeine in third trimester, even when you're using the therapeutic dose, it could
Yeah.
affect the newborn, it could affect the neonates. That's it could affect the newborn in the first 28 days. So the newborn can start having like withdrawal symptoms from the codeine. So it's not really advisable to use that one in the third trimester. But every other medication can actually be used. So
Yeah, I think it's a thing of, benefit outweigh the risk situation because
exactly.
I'm not sure what the percentage is, but I know that the percentage is quite small in terms of having opioid interfere with the baby, whether during pregnancy or during breastfeeding. Because I
Yeah.
know that a certain amount of codeine sort of seeps into the breast milk and things like that.
Yeah.
But I believe that the percentage is small. So it should just be okay, a discussion between the patient and the
The doctor.
physician, the doctor managing to just sort of
Yeah.
see the situation, assess the situation, and if the benefits outweigh the risks, then
Because of fear about the use of painkillers during pregnancy,
hmm,
some sickle cell pregnant women would rather like endure the pain than treat the pain. And when you do that, you're at risk of under treatment. Do you get? And if you are not being treated well, if you're not managing the pain well, that pain, when it's not properly treated, can be associated with hypertension, anxiety, depression, none of which is conducive to a healthy pregnancy. So, being aware that painkillers are actually not contraindicated, as you can actually use them in pregnancy, is really key.
yeah. Because for me, if I put myself in that situation where someone tells me there's a percentage to, if I give you this medication, it can affect your child or whatever, I'll definitely just know most. Let me not say definitely because
But
sometimes you say something and then you're in the situation and it's a totally different thing you get. But
yeah.
right now, just thinking about it, it would be a no-brainer for me to say, I don't want anything to happen to my child, and I'd rather just take something milder like paracetamol or just use something like paracetamol than actually going for those medications, even though I'm at a point where it's a pain where those medications are needed. I'm the kind of person that would opt out of them.
Okay.
Yeah. Now, the next question is priapism dangerous to the fertility of a male warrior? Can it be stopped permanently or is there any temporary relief for it? So if you can just give a background of what priapism is. Basically, it's just
Mm,
like sustained erection that is not
yeah.
sexual stimulation and it's painful. So
Okay. So you just gave a background information on pre-application.
yeah, I know. I was going to ask you to
And
do it, and I just found myself. So awkward.
yeah, but thank you for doing it. Yeah, but what you should also understand is that, like Ivy said, it's not necessarily as a result of sexual stimulation. Sometimes the penis can be erect for other reasons. Normally, how an erect penis works is when the penis is stimulated psychologically or physically, like by touch, there's blood flow into the penis that makes it erect. And then when that stimulation goes, like when the stimulation ends, the blood flows out of the penis and then the penis returns back to its non-erect form. So in priapism, what happens is after there's stimulation or no stimulation, blood just decided to flow into the penis. It stays there, it's trapped there and cannot leave the penis. You end up getting an erect penis for greater than 4 hours. And this can cause really severe pain in the ischemic type. There are two different types. And then the ones that are commonly seen in sickle cell warriors is the recurrent one. It's sort of ischemic priapism, like the one I just spoke about. And it's because the red cells in sickle cell is sickled, the shape. So it can block the vessels in the penis and it traps the blood and prevents the blood from leaving. It's recurrent. It occurs really, it gives like several episodes. And when this happens, because when the blood is trapped in the penis, there's no oxygen getting to the tissues in the penis, and it can damage or destroy the tissues in the penis and can cause erectile dysfunction. So you asked if it is dangerous to male fertility.
Yes.
Well, erectile dysfunction can make it difficult or impossible to have sexual intercourse. It's not like it directly causes male infertility, but it is often seen in conjunction with each other because of the inability to even have sexual intercourse at all. So, and then you ask for a temporary relief.
Yes,
Yeah,
yes. Can it be permanently or is there any temporary relief for it?
well, why it can't be stopped permanently per se is because as a warrior, the red cells are sickle, so there's still like a chance that it will happen again due to blockage as a result of the sickled cell. So there's a temporary relief for it, like it's because it's an emergency apparently. So
Yeah.
you have to immediately go to a hospital, and then the doctor would drain out with a syringe and a needle, drain out the trapped blood, and give some painkillers and fluid. And sometimes, if after this treatment there's no improvement, a surgeon can come and then change the route of the blood flow in the penis. So,
Oh, that sounds like
yeah.
a lot. Okay. The next question says, what does pregnancy in a cell warrior look like? I understand it's high risk pregnancy. What are the things to expect in a sickle cell pregnancy?
Some women with sickle cell anemia, some sickle cell warriors can have a healthy pregnancy, like from the beginning to the end, like till delivery, a healthy pregnancy. But as a warrior, you're more likely than other women to have health complications that can affect your pregnancy. Complications like pain episodes, infections, and vision problems. The pain episodes may happen more often. They can last like a few hours to days to weeks. And as a warrior too, there's also like this increased chance of premature birth and low birth weight in pregnancy. But there are warriors that have like really healthy, uneventful pregnancies from onset to delivery.
Yeah. Does the constant sickling affect the male and female reproductive organs?
Yes, it can affect male reproductive organs, but very little is known about how it affects female reproductive organs.
Hmm.
Infertility in men that are warriors have been studied more frequently than infertility in women
It's just,
because they've not really seen like significant cases of infertility in female sickle cell warriors. So they are focusing more on the males. Like 24% of men with sickle cell disease may develop a condition called hypogonadism. Is That's just a condition that is associated with low testosterone production, infertility, erectile dysfunction, poor libido. And then they've also noticed sperm abnormalities in male warriors, like low sperm counts, low sperm density, the sperm not being able to move really fast, then maybe with abnormal shape. Like the sperm has a particular shape, but they've noticed like abnormal shapes in male warriors. Although it's important to note that male sickle cell warriors with sperm abnormalities have been fathering children. So studies are yet to determine the clinical importance of abnormal sperm analysis and its impact on male fertility in male sickle cell warriors. So,
but in
but for
female
the
warriors, like most studies haven't really been carried out.
Yeah, the studies is limited. And the only thing that I saw a study where they talked about increase in sickle cell disease related pain during menstruation. That was like the only significant thing they talked about the relationship of sickle cell with reproductive organ. So
Okay. So, in terms of a sickle cell patient now having fertility issues, what fertility assisted options is available to sickle cell patients?
yeah, almost everything that is available for non-sickle cell patients is available for sickle cell warriors as well. It's just the fertility physician has to work hand in hand with the hematologist. So you can do ovulation induction, that's we give medications to stimulate production of mature egg, and then we tell you when to have sexual intercourse with your spouse. And there's also the option of intrauterine insemination and in vitro fertilization, that's IVF. But we have to work hand in hand with the hematologist because some of the medications used in these procedures have a side effect of blood clotting, pulmonary embolism. And sickle cell anemia itself, their risk of forming blood clots as a complication of sickle cell normally. So if we have to use medications that have that side effect, it could increase the chances. So in a case like this, we want to work with the hematologist. So the hematologist would most likely prescribe medications that will prevent clotting and then monitor closely as well. So, and then we'll use like minimal doses of those medications. Not, we won't necessarily use like the same dosage. But like I said, it's not the same for every patient. It depends on the
Yeah,
go
every
ahead given by the hematologist.
So is there a limit to how much fertility treatment that a warrior can get?
Well, I won't say there's a limit. Like I said, treatment is individualized. If, as a warrior, you've had a previous history of blood clots, like pulmonary embolism, then yes, there's a limit, sort of, because we can't be doing the same thing we do for somebody that has never had that history before, or somebody that is not prone to that. So it's like I said, treatment is individualized. I can't put a cap on it. So it depends on your history.
Yeah. Okay, so is there any medicine or things that a warrior can do in their own personal life or to just improve fertility and their chance of a full-term pregnancy?
Well, I think what they can do is not have unplanned pregnancies,
Okay.
because pregnancy on its own increases your chance, whether you're a warrior or not, increases your chance of forming blood clots, because we describe it as a hypercoagulable state. So you don't want to have an unplanned pregnancy. You want to plan the pregnancy with your hematologist, with your gynecologist. This would actually give a better prognosis, because then they start managing you from the onset of conception. So it's close monitoring. If they have to check your blood levels as often as they want to, they'll do that. More ultrasound scans than a non-warrior, and all of those things can give you, like, increase your chances of carrying pregnancy to term and having like an uneventful pregnancy, like multidisciplinary approach to
Yeah.
management and
Yeah.
starting early.
You mean like starting your pregnancy planning early or
Early, yet, yeah, like when I mean early, I mean you are involving your doctors from
okay,
the
from
initial,
the get-go. Yeah.
from the get-go.
So are the female reproductive hormones, are they usually affected in sickle cell patients?
Well, there's, like I said, studies are limited with regards to this, but there was a study that showed that a subpopulation of women, like a few, just like a small section of women, had increased sickle cell disease related pain during or any part of the menstrual cycle. That it was as a result of fluctuation in the levels of estrogen and progesterone. But they didn't talk much about this. Like, we need to do more research when it comes to
Yeah.
women, really.
Yeah, I guess I don't know. Maybe they've seen that in terms of like sickle cell patients, it seems to be less affected in women
Yes,
than for men.
yes. There have been many successful pregnancies with sickle cell warriors.
Yeah.
So,
Even in my practice, I've seen a lot of success than I have seen
yeah,
on the other end of it. Like you said, it's just, start your pregnancy planning early with your team of doctors, your hematologists, your gynae, and just everybody, so
yeah,
that you do the right things, you're able to just follow through. And yeah. So I think you've answered this question though. It's about if, the disease affects the sperm counts. I know you said it does
yeah.
affect the motility.
The motility, the count, density, the shape, it does affect it.
Is it common?
It is quite common. I can't categorically give a statistics, but I know it's more than average.
Hmm.
Yeah, for sperm abnormality. And I also added that but men, warriors with sperm abnormalities have been reported to have children, to father children. So the studies are not really conclusive
On
as
the
to how
significance
it
that it
affects, yes, men infertility.
So during a sickle cell crisis, is it normal to experience delay in menstruation? And also, do sickle cell patients tend to have like abnormal menstruations and just things involving the whole puberty and
Mm,
menses process?
yeah, you can have like delay in menstruation because the crisis is a form of stress to the body. And the stress from pain can throw your hormones off balance. It can even affect the part of your brain that is responsible for regulating your period. Yeah, it can cause a delay in menstruation. It can also cause either prolonged duration or short duration of your period.
Okay.
Just the same way stress will do that.
Yeah. What are the common fertility problems, preventions, and treatment? I think we probably answered most of this anyways, but so I'm just going to leave it
Yes.
as what are the common fertility problems
Common fertility problems.
in sickle
That's
cell
like,
patients? Yeah.
okay, just like what I explained, it can cause a condition called hypogonadism that's associated with low testosterone production, infertility, erectile dysfunction, and then the sperm abnormalities as well.
Yeah.
But for females, I really can't say.
So would you say like the process of pregnancy is dangerous to a warrior and the whole underlying physiology of how a sickle cell patient's body just functions?
Well, like I said, I can't generalize this because for some people, it's just like a walk in the park. It's uneventful. But warriors are at risk of more health complications than non-warriors. And this is because pregnancy, like I said, the hypercoagulable condition. This means that pregnancy on its own can increase your chances of blood clots. So when this happens, there's like an increased chance of crisis in every part of the body. So there are more pain episodes and yeah. The question was if it's like high risk for them, right?
Yeah, if the process is dangerous on sickle cell
Yeah. So
patient.
yeah, that's basically because some people, yeah, it is because of the increased risk of crisis and health complications.
Okay. And I think early on in one of the questions that you were answering, you talked about involvement of sight and vision. So what are the chances of a warrior going blind from, pregnancy?
Okay, so I'm not aware of any increased chance of visual problems with pregnancy because sickle cell anemia on its own has a complication of visual problems because of the sickle cells can block tiny blood vessels that supply the eye. So over time, it can damage the eye and lead to blindness. I don't know if during pregnancy this is increased. I'm not aware actually if it is increased during pregnancy.
What my advice would be for this question is just get your regular checkup. Even just not
Yeah.
pertaining to pregnancy now, as a sickle cell patient, you should get your regular checkup, your general assessment of how your health is, and check your eyes regularly because, the disease affects the eyes. So you need to see your ophthalmologist and they need to look into your eyes because even if there are changes, if you catch it early, it doesn't, there are procedures you can do to stop the changes. There are things you can change, and just catching something early is also always better than catching it late. So just get regular checkup. Check your eyes, check your body, be aware of what's going on in your body, and be intentional and be deliberate about the things that are happening in your body and things that concern your health. That's it.
Yeah.
What would your advice to a sickle cell patient who wants to undergo fertility treatment, or is it advisable for a sickle cell patient to undergo fertility treatment?
Yes, it is. Like, well, let me not say it is because I won't be the one to advise. I think your hematologist will be the one to advise you on whether you should go for fertility treatment. And if you come to me without having clearance from your hematologist, I would refer you back to your hematologist because I'll need to go ahead.
Yeah.
And I'll need to work hand in hand with the hematologist. So it all depends on your history. Sickle cell patients have done IVF, like they do IVF. They are not as common as non-warriors, but yes, they do IVF, and it's been successful.
That was the last question, and I believe that we have come to the end of this episode of Beyond the Genetics. So, the general thing you should take from this episode is just be aware of your health, go for your regular checkup, check what needs to be checked, and just be in a general knowledge of everything that's going on with you and your body, and consult with all parts of your medical team. So, Dr. Amarchi, thank you so much for being here. I will urge everyone that is listening to please check out her YouTube channel. She's doing such amazing work. And you can follow her on Instagram. What's your Instagram handle?
Doctor underscore Amarachi with a double I.
Okay, so follow her on Instagram. You can also follow Little Cell of Mine on Instagram. I think that is Elcom underscore Foundation. That's the name of our Instagram page. And I look forward to having you tune in again to listen. And have a good day. Bye.
Bye.